Good morning.
Good morning, Rob. How are you?
Wonderful.
Good, good.
Hey, thanks for taking your time. And what we'll do is, because we'll be showing this to the medical school students, so I will cut the first part, and then when you introduce yourself, that will be kind of what I'll start showing the students.
Okay,
I appreciate your flexibility. Like I say, we have about a 4 hour talk for students on global health, where
okay.
where one of the doctors in the medical school kind of goes over some very particular issues that they would see
Mm,
for who've traveled to various countries. And then we look at healthcare systems,
okay,
right? And almost all of our students are only used to an American healthcare system. So we start doing some education on other people's experiences, in
okay.
this country, what they might, you know, that's why your experience is very valuable because you're the expert in the room, right? Um,
Okay.
so that would be super helpful. So thanks for your time.
No problem, Rob. No problem.
Okay, well, as we get started, would you please introduce yourself?
Okay, so my name is Agus Sofyan. I am originally from Indonesia. I moved to United States in 1997, so already about 27, 26 years ago. And I graduated from UK with PhD in environmental science. And now I'm working at UPike as a faculty in biology.
Perfect, and we're so glad to have you. Let me tell you. Um,
Thank
could
you.
you could you do a little bit of describing the cultural context of Indonesia?
Yes, so Indonesia is located in Southeast Asia, which is this tropical country. So based on this, the culture mostly related to the area or the zone over there, which is a tropical country cultures. So we are very what you call this very easy, relaxed peoples. So most of us actually really happy peoples. So therefore, sometimes if we have problems with governments, we just take it easy, including if we have a problems with the health care system that we have in that country. So our culture is really different because we have more than 100 culture or ethnic groups, and each ethnic groups they have their own kind of culture and habits. So it's kind of a little bit difficult. And also, based on demography, we have more than 17,000 islands. 17,000 islands. You can imagine that. It's for the healthcare system, it's gonna be kind of challenging, to reach all the people on that area. And we have about 287.7 million peoples in Indonesia. So we are number 4 in the world based on the populations. That's maybe a little bit information about Indonesia and the culture and also populations.
That's fantastic. 17,000 islands, 100 ethnic groups.
Yes.
Wow. So clearly you're not able to say all of Indonesia or every Indonesian person, but within your own ethnic group of that
Okay.
100, what
Mhm.
is that particular ethnic group?
I am from the capital city of Indonesia, Jakarta, which is the biggest city, the largest city in Indonesia. We have about more than 25 million people live in the city. So this is a not only metropolitan, but it is also megapolitan city. And our culture, so people that originally from Jakarta is called Betawi. So Betawi ethnic groups. So we have mostly our culture is affected by Islamic culture because most of Betawi peoples, let's say 99%, they are Muslims. And we also affected by Chinese culture. So many of our culture in Betawi is also affected by the Chinese culture, including the clothings and the food that we eat. Because that's the kind of background of my original culture. Ethnic group is called the Betawi people, Betawi ethnic groups.
Perfect. Thank you. That's fantastic. So when we think about the various types of healthcare we see around the world, so maybe like socialized medicine, kind of a national healthcare system, the system that we have in the United States. Could you describe what type of system that people from Indonesia would experience?
So we changed several times. Okay, so after our independence in 1945, our first president, which is President Sukarno, took over, kind of nationalized most of the hospitals in Indonesia. It's become government or public hospitals. But at that time, we we were not able to give all the healthcare service to all the peoples. So mostly just, some government employee that have the, service from that public hospital. Other people should pay, or maybe, they have to use their own money. And then in 1965, we changed that healthcare system with the new president, is Suharto era. We call this the new era. And in this case, Suharto, the president of Suharto, actually gave most of the service to the government employee and also to the armies. So most Indonesian people actually did not get the service from this healthcare system. And then in 2014, we have new system. It's called the National Comprehensive Healthcare System. This is for all Indonesian populations. So this is 2014. So we follow the national healthcare system, where Indonesian government is the only payer for that one. And then Indonesians populations or people, they pay the premium based on their status, based on their conditions. So for examples, okay, so the providers for this healthcare system is multipliers. All the all the public hospital and clinics will be involved in this healthcare system, and some private hospitals and clinics also involved in this healthcare system. So they are the providers. And for the premium, it is based on the Indonesian people condition. We have, according to the data, 2017, we have about 34 peoples or populations within the poverty lines or near poverty lines and disabled. So for these populations, the premium is really low, even free for some group of people, to up about $1.75 per month. So this is the monthly premium for these groups. So the first group. The second groups, we have informal workers, the worker that, work, but they don't really have the institutions. So this, we call this informal workers. For these groups, the premium is about 2.3 up to $5.40 per month, which is cheap, okay, for this, for the population. And for this kind of group, they have the ability to get service at least to what we call the third class or second class beds in the hospital. So in the hospital in Indonesia, they have classes. So the first class is going to be the most expensive one, then will be second class and the third class. So these two groups, they can access the second or third class beds in the hospital, in the public hospital or some private hospital. And for the formal workers, this is the one that have institutions, the one that work at factory or government, for example, the premium based on their salary, based on their monthly salary. So the higher the salary, the higher the premium that they have to pay for the healthcare system. And they can get, of course, second or first class of beds in the hospital. So this is different levels of populations that get the comprehensive healthcare system in Indonesia. So this is what we follow right now since 2014.
Perfect. So I take it that every person is covered at
Yes.
different levels, but every person is covered. Not everyone's asked to pay a premium. Some people
Yes.
are asked to pay, but it's on a sliding scale based on kind of a person's income or no income.
Yes.
There really are tiers to the types of level. You can really get gold standard care if you
Yes.
okay.
Yeah, that's the benefit. Everybody get the coverage, at least if they, if they register to the government. So the government actually, kind of manage this system. So the people have to register for this system in order to be able to get the service.
Okay, thank you. Now, what would you say are some of the benefits that you've seen in this type of healthcare system?
Yes, the benefits, as mentioned before, now more people actually have access to the healthcare system in Indonesia compared to before that, because before that, only several type of people can actually get the access for the healthcare system. Now, everybody, as long as they register, they, they apply for that healthcare or insurance, they will get that benefits. And also more people actually can afford to pay for the healthcare system and also for the healthcare service with this type of system, national system that we have right now.
Thank you.
Okay.
Do you see in your experience, I know that
Mhm.
your experience probably is a lot before this
Before
change.
that.
During your time there, or when you traveled back, have you seen any ways that people suffer because of this system?
If we talk about the system before this, in my era, for examples, so usually our parents, our family, when we go to the doctor, we have to pay with our own money, so out of pocket, because my parent is not really formal workers, government workers, so we have to spend out of pockets. This is the first. Second, many Indonesia actually do not go to the doctor if they do not have sickness. You see that one? There is no, there is no, like over here, you have the annual checkup, for example. We don't have that. Many Indonesian people, they don't want to go to a doctor if they don't have sickness. And even they say that I don't want to go to the doctor because if I go to the doctor, I will know that I have illness. They're scared. So they feel they are safe, okay, with not going to the doctor. We don't have the general checkup. So that's the kind of the habit, culture that many Indonesian people have. Until now, they also have that kind of habit or condition. So also in many parts of Indonesia, also almost most part of Indonesia, they also have other kind of service. They don't have to go to the doctor. We have what we call, maybe you know about shamans. So shamans, so they sometimes they go to shaman, like myself, for example, and all my siblings. We actually were born not in the hospital. We were born at home with that kind of shamans. So we call them, to help, deliver the baby, etc. So many people still have that shaman kind of thing until now, actually. Okay, so they
Okay.
have, they have the ability also to, instead of going to the doctor, they go to that place. The same thing with the second, the healthcare system that we have right now, to 2014. There is some problem and issue with that one. We mentioned before that Indonesia have so many population and so many islands. Sometimes in the remote island, they don't have the hospital, and they have to pay a lot of money in order to go to the hospital because the hospital only may be available in the big city. So for these people, even though maybe they are registered for the healthcare system, they will not be able to go to the hospital also. So these people might still use the shaman for some of their service, okay, in some area.
Well, you've opened up a window for me to ask a couple more questions. When you think about a shaman who comes to help a baby be
Yes.
born,
Mhm.
we might use the term like a midwife, a
Okay.
doctor who comes to the home. Now, our shaman, but midwives in the United States are trained and professional.
Okay.
Are shamans medically trained?
No, most of the shamans, they are based on their experience. They are not trained. But there are also the nurse, what you call the nurse, that also come to the house to help, delivering the baby. That's different. But this one is the one that, people know it, that she or he, so this is also not for delivering baby, but also for other services. Like, for example, if you break your bone, some people will not go to the doctor, but go to the shaman. And the shaman give you the local medicine or whatever to put it on your bone, to fix that. Okay, so they are not trained doctor, or they are not trained medicals, kind of people. They are just based on experience, and sometimes people think they are able to help them with that, kind of illness or service.
So many people would be more comfortable
Yes.
going to shaman than they would to
Yeah.
doctor. And some of that could be about access. If I live on a remote island, I have much more access to. And would a
Yes.
shaman also have like spiritual practices that they are using, as opposed to they might be using herbs and leaves, but
Yes.
they're also using some type of like prayers and things?
Yes. So many of them actually also using the prayers, so spiritual prayer, in addition of medicals, herb that they use. So sometimes, they're going to pray on, for example, on the water. If the people drink that water, it might cure the disease, this kind of things. Okay. Another things about this health system that we have right now, because we actually have a very low ratio of doctor and patients. So in Indonesia, only 0.6 doctor per 1,000 population. So it's very low number. So therefore, many people that have this healthcare system, if they go to a hospital or go to the doctor, it's going to be long wait. So sometimes they have to, it is not like here where you actually can register through online, for samples. In many Indonesia place, if they want to go a doctor, they have to come to that place maybe 3 a.m., 4 a.m. just for register. And then the office, the doctor, the hospital open like for example maybe 8 or 7 a.m. So you know what I mean? So it's a long wait. It's not only for register and also to get the service. So many people right now, for example, even though they have healthcare service, sometimes they go to another doctor, the private doctors that accept the out-of-pocket money, which is faster service. So that's another problem and issue that we have. Like just examples of my mother, for example, my mother is old. Sometimes she cannot really afford to go to the regular doctor with the healthcare system because it's going to be long wait the whole days, So it is better that, my sister, for example, will bring her to the doctor, the private doctor that have a faster service. So that's another issue that actually we have also in this system, because we have a very few doctor that involved in this kind of service. So some people might take shaman or might go to another private doctors.
Okay, that's helpful. And then, when you talk about the 17,000 islands, if a person's sick and they're not living in like Jakarta or someplace like
Yes.
that, would they then have to get on like a local ferry, or would they most likely have to get on a plane to go to a place to access a hospital?
No, yeah. Many of them actually using ferry to go to the hospital. We don't have the luxury to use airplanes or the helicopters like the ambulance helicopter like here. We don't have that luxury. So they have to pay by themselves. Sometimes they have to use their own motorcycles and then go to the, using the ferry to from one island to another island. It takes a long time. Sometimes many of them just give out and stay in with the illness in that place. Okay. And again, shaman in this case will be very helpful for them.
Well, and that's what I'm thinking about is if I were very sick and I'd have to get on a motorcycle and a
Yeah.
ferry and then go to a place at 3 a.m. or 4 a.m. to wait in line to get registered, it
That's
makes
right.
a lot more sense why I may turn to a shaman who can come to my home and so
Take care of, yeah.
yeah, right. That seems to make much more sense. So in this system, then, what role does the average citizen or community play in health
Okay.
that you've seen?
Okay, so Indonesia, we don't really have the training like the CPR training. It's kind of training for, regular peoples. So most of them don't have that kind of trains. The one that give the service only, the one that have educational trainings like a doctor and nurse. So that's the only people that can give you the service for if you have some problem with your illness. So regular peoples usually they confuse. They will not be able to help someone if someone, for example, just pass out in the crowd. They don't have the ability to do the CPR and also kind of things. So most of Indonesian don't have that train. The even though it's very small train, but they don't have that kind of training. So they mostly just take that person to the hospital by themselves or call the ambulance. And this is another thing in Indonesia, especially in the bigger city like Jakarta, where the traffic is really bad. So the ambulance will not like here, you can go very fast from one place to another place. The ambulance over there, the ambulance still be in the traffic. So they still stuck in the traffic because of that massive vehicles that we have in the many bigger city in Indonesia. For smaller city, maybe it's different.
So even if you are in a mega metropolitan
Yes.
city like Jakarta and have
Mm.
all the resources,
Yeah.
simple traffic, you could have a
Yeah.
major delay because of that.
Yes. That's right.
Okay.
Unless if you are, like say, you are manager, you have money. Sometimes you can call the helicopter or airplane for that ones. But if you are just regular people, then you have to really be patient with the traffic that you have. So that's the kind of things that it's a daily problems in our country.
And one last question, and I so
Yes.
appreciate your time. So growing up in one healthcare system in Indonesia, and then in 97 when you come to UK, and then now you have gone back, and I know that you go back.
Yeah.
You personally experienced this new form of healthcare in your own since you've been back to Indonesia?
I don't really use that because when I go back to Indonesia for maybe 1 month or 2 weeks, if I get sick for some, most Indonesian that live in America, when they go back to Indonesia, they will have kind of diarrhea. That's number one things happening. We just take the medicines that we bring from United States, or maybe we buy it in Indonesia. So we don't for myself, for example, I never go to the doctor or hospitals during my stay in Indonesia so far. I hope I will not.
So you wait till you come back to the United States.
Yes, yeah.
Well, again, we we are so thankful that you're here at UPike to be able to share your knowledge and your experience. And I surely hope that soon students will be getting on a plane with you to be able to go experience Indonesia, and you can
Yes,
lead us on a trip there. So
yes.
again, thank you so much for your time. Thanks for sharing with our students.
Thank you for this opportunity, Rob. Thank you very much for having me.
Okay, bye.
Bye-bye.